Indiana Center for Assisted Living says the spread of COVID-19 in nursing homes is not a result of inattentiveness. Their organization's president wrote an opinion piece over the weekend. Eyewitness News' Kayla Sullivan reports from our Indiana State House newsroom.
We're doing the best that we can.
Indiana Center for Assisted Living President Zach Cattell says even the nursing homes that follow everything by the book are seeing coronavirus outbreaks. They're facing the challenges of asymptomatic people, a PPE shortage, and the most vulnerable population out there.
Not to say that there aren't things that can be improved on, but really we need to tell the stories of the hard work that these dedicated professionals are doing every day.
Some of the criticism has come from those seeking COVID-19 related information from nursing homes. The state says it won't release that info publicly.
Because we respect that private business, that nursing home that is operating under our regulations, and that's where the relationship exists. And by the way, we have taken a few extra steps to make sure that if that's not, that we're going to intervene.
So Cattell says he's seeking consistent guidelines on how to inform current and future residents and their families on COVID-19 data.
The last thing that we would want are disjointed state and federal communication guidelines that make it even more confusing for family members to get information from the nursing facilities.
He says efforts by long-term care facilities to build COVID-19 wings or buildings should be recognized, not demonized, citing three main benefits.
One, you're able to appropriately isolate individuals that have the virus from folks that don't. You're also able to increase efficiencies in terms of use of PPE that's available. And third, you're also able to isolate the staff that work on that building or on that dedicated building or in that unit so that you're not cross-contaminating individuals based on their work with COVID-only patients.
From the Indiana State House newsroom, Kayla Sullivan, Eyewitness News.